Many of the bigger universities have just gone into their endowments, and they have freed up a fairly significant portion of the principal in their endowments, the larger universities, and specifically applied those to lower admission costs to make the higher universities in this country more accessible to more of America's youth. I fully encourage that trend. It forces all the colleges to follow suit. When it's cheaper to go to Harvard than it is to go to Slippery Rock, people are going to tend to go to Harvard, we think. And that's probably a good thing. I would certainly back federal incentives to invite those universities to continue to modify the size of their endowments to that purpose. I am the only candidate in this race right now who has endorsed specifically H.R. 676, which is a single-payer health care program, which is endorsed by 59% of America's doctors. It's been endorsed by Jim Moran of the Virginia 8th. It's been endorsed by Bobby Scott of the Virginia 3rd. And it has 93 current sponsors in the U.S. House of Representatives. It is the answer for health care, and we can get into the specifics down the road just a bit in this discussion. But single payer is the answer, and I want to restate what I just said. I am the only candidate in this race who has a specific, detailed proposal of how to fix a broken healthcare system.
Starting with education, we all know that the education is the ticket to success for individuals and for our economy. On college education, we've seen student loans deteriorate over the last few years. At the same time, tuitions have risen. What we need to do is to go back to more direct lending from the government for student loans instead of going through banks, which costs us more. We need to expand Pell Grants that help low-income students afford education. And we need to get that education for our veterans. I'm a firm supporter, strong supporter of Jim Webb's 21st Century GI Bill that will make education guaranteed affordable for the folks coming home from the war in Iraq. On healthcare, it hurts us, and we find people every day who can't afford healthcare and don't have the insurance to pay for it. Let me give you the 5 concrete steps, and I'm going to give them quickly because Bob's going to pull time on me, to get everybody, guarantee good quality health care for everybody. First of all, benefits that really cover us when we're sick. Benefits as good as members of Congress have. Choice of a health plan. Stay in the health plan you have if you want to, but you can choose another public or private plan. 3, in all those plans, bring an end to discrimination based on pre-existing conditions. I see lots of folks like me who have a lot of pre-existing conditions. Healthcare and health insurance have got to work for us when we're sick. 4, health insurance and health care have got to be affordable for us based on what our incomes are. That means watching the premiums and the cost sharing to be affordable to us. And 5th, we need to get a hold on spiraling healthcare costs by investing in 21st century information technology, promoting prevention, management of chronic disease, and research on what is effective to get our value for the dollar. Thanks.